Hello, welcome to our Surviving Work conversation about bullying. So we have with us to help us with our conversation Elsie Gayle, who's worked for a long time as a midwife, and Angela Eden, who's worked with organisations, particularly on the issue of bullying. Just to contextualise it, out of the Francis reports came some very disturbing quotes and statistics about bullying in the NHS following the Mid-Staff's inquiry, and the NHS was described as working under a pervasive culture of bullying. So bullying has had a lot of attention, unfortunately. So today we're going to try and think about bullying. One of the real difficulties with bullying is to have thoughts. It's a very disorienting experience for people that are having it. So we're going to try and draw on our experience to understand what's going on with bullying and try and draw some suggestions about how to cope with it within your working life. So I'm going to ask you first question, which is just to summarise, if you can, your experience of working with bullying at work.
It came up in the context of being an organisation consultant and people coming to me with concerns about their jobs and being excluded and being sacked and not performing properly. And what it seemed to me was actually not about their performance, but about the communication between people inside the organisation. So an authoritative order to do something was sometimes seen as okay, but a continuous harassment around people's performance moved into bullying, and a lot of people didn't recognise it as such. So for me it was always around what was being communicated and why it was being communicated and who held the power. So that's why I got into it.
And Elsie?
For me, it was about experiencing bullying and actually recognizing that something was seriously wrong without realizing at first what was going on. I had returned to work in a particular place that I'd worked before, and I was being mistreated by somebody who I hadn't troubled in any way. I hadn't done anything to this person, but she started harassing me, and it got to a stage where it was seriously affecting my performance at work. And I was then referred by another member of staff to the occupational health, who made the suggestion that I was being bullied. Never thought about the term before and never experienced anything like that before. So it was really something very new to me, and I had to then start to look at it, research it, and deal with it.
So your experience, this happened when you were working as a midwife, and I'm wondering about why you think that midwives, who apparently are very vulnerable to bullying, what's in the work, what's in the setting for midwives that makes them so vulnerable to bullying?
Having thought long and hard about it, I've come to the conclusion that midwives, by their training and the nature of their work, need to be autonomous in their practice. They need to be able to make clinical decisions based on best evidence, but also based in the needs and the values of the person that they're caring for at the time. Whereas they have been shoehorned into this hierarchical system with very strict guidelines that have actually now become protocols and ways of working from which you dare not deviate otherwise. There is also the legal system that's been introduced into midwifery by way of the clinical negligence scheme with its strict, I think the premise was a good one, whereby the guidelines and the protocols would prevent insurance claims, indemnity claims. But in actual fact, the unintended consequence of that was to shoehorn midwives into working into ways that were against their midwifery ways of working and not necessarily good for the work that they were supposed to be doing.
So if I said to you, it was a clash of value systems, whatever the training and the reason for coming into midwifery, I love the way you say shoehorned in, it must have felt like a betrayal of the value systems that you had in terms of bringing a child into the world. Does that sound familiar? Have I got the right words?
No, it does. And it's really a misunderstanding and the fact that the two sides haven't come together to explore what the best outcomes should be and the best way forward. So it is almost by default now that these things are happening. So the clinical negligence scheme has been rolled back. They've been more or less disbanded in midwifery. And actually midwifery is now undergoing a review as a result of some very serious issues that have been happening in midwifery, in particular the Morecambe Bay report.
Yeah.
So I think that's part of it. And the other factor is that there is a vulnerability about looking after a woman, and a very fine line to be drawn in the way you look after a woman, because actually she is the decision maker, not the professional. As long as she's got mental capacity to make a decision, it is her that makes the decision, not the professional who should know everything about everything. And sometimes we actually blur those boundaries. The woman doesn't complain, the behavior goes on. The other factor is the environment in which the midwife has to work. So if she's working in an environment that is abusing her and her right to work as an autonomous clinician, then those things actually will pass on to the woman. So you have this kind of cycle that keeps, and in fact it does get worse. And I think that is what happened to me when I was bullied, because I went into a situation whereby that had been just left to escalate, because midwifery in itself seems to sit aside from the main acute trust. Whether it's the mystique around birth or the difference in the profession, it largely sits outside of the mainstream acute trust. So what actually happens then is that things just kind of, certainly in my situation, the cycle just got worse and worse. So by the time I entered into that situation, and I was coming from a situation where I was an absolutely autonomous clinician. I was, working at the height of my career really as a midwife, in a place where I could and was encouraged and allowed to do and expected to do that. To come into a situation where I had to sort of be bowing and scraping to people who were then bullying me because I was saying, in my clinical judgment, this is what needs to happen. And they didn't like it. So in actual fact, I kind of came a cropper in a situation like that.
But working in the medical field has always been very hierarchical, hasn't it? With the doctor and the consultant and then the lowly nurse. It's always had that chain of command in which the actual practitioner that's getting their hands dirty doesn't have as much say as somebody who strolls in at some point in the day.
Yes, but dare I say that in midwifery it was slightly different, because in fact the midwife on the ground, well, the lead midwife in the field of this hierarchical situation that's been created for midwifery, she was in fact a feared person alongside the consultant. So it was slightly different to nursing.
Okay.
And the people with the midwives, the hands-on midwives on the ground, which I've always been a hands-on midwife on the ground, really. Never aspired to management, to be honest. You were more vulnerable in terms of that. But it was slightly different from nursing, in as much as the lead midwife actually had, quite a bit more power.
And I think you're saying that that's been eroded. It's being limited. Is that?
It is being limited. And in actual fact, the more I look into how the profession needs to operate now in terms of evidence, it really needs to be woman-centered, evidence-based, and in fact, woman-centered, parent-centered, in order for the best outcomes to happen. But I think that is being realized now, and it is struggling to push back the hierarchical nature of the, in fact, male consultant scenario. Really.
One of the questions I have about the experience of being bullied is that, particularly if you're working in a workplace that has a very established culture and way of doing things, it can take quite a long time for people to know when they're being bullied. What was the point at which you realised that you were actually being bullied?
It was really difficult, actually, to come to that understanding. I think some of it came from the fact that I was becoming very uncomfortable in a situation that I prior to that was feeling quite comfortable in. I'd been you could just drop me anywhere and I'd function as a midwife. There was no problem. And even if I didn't know the absolute fine details of the protocol, there were still safe boundaries within which I could work. So I began to feel very uncomfortable and then very niggled by the behavior that I was experiencing, and then feeling very scared. So it was more sort of both physical and I would say emotional and psychological feelings that something was so wrong. And then it being said to me by the person in the occupational health department. It was actually a nurse that I saw. She made that suggestion. But the worst thing was, and I was almost suicidal. Well, not almost. I was suicidal at one point. It was so horrendous. I couldn't. But and it was like I was frightened. I couldn't. I was just like stuck. I couldn't relax. I couldn't eat properly. It was awful. I had to go to work, but I didn't want to go to work, and it was terrible, really.
That ties in with all my experience and the things people tell me, and a little bit from my own experience, is that you lose your sense of self and your ability to make a good judgment. You lose this sense of judgment. Yeah. Like, is this right? Is this wrong? Am I going crazy? Yeah. Maybe I'm making too much fuss. Maybe they're right. Maybe I'm wrong. And just losing a sense of your own, not moral compass, but also your emotional compass. Yeah. You lose who you are, and you become sucked into a system that's not of your, or a set of behaviours that's not of your making. I was going to answer that question had you asked me, but I'm joining in.
That's fine.
So it is both gradual, bit by bit by bit. You're asked to do too much, too often, too late, impossible to do it, under-resourced, too many demands. That's one sort of bullying that just sort of creeps up on you, starts off with a bit of too much to do, intensive and horrendous demands on your work life. But there's other organisations in which bullying is part of the culture, and the moment you go into it, you're bullied. So this is not so much health and social care, but in other settings, things like awful, abusive inclusion ceremonies into a certain sort of trade or job. I mean, that's bullying. That is absolute bullying, and it starts on day one. You're lowest down on the pecking order, so you will do the shit jobs.
Yeah.
Actually, that happens in health and social care too.
Yes, I was just thinking back to my student days. In fact, people were asked to go and get a fallopian tube from the theatre and all this sort of business,
Yes.
And then you'd make an apple pie bed and things like that. That's so right. I think, but there's a point at which it's fun, sort of.
No, it's not fun. You see, that's one of the things that bullies say.
You see, I just fell for it, I laughed.
Yeah, no, that's one of the things bullies say is they can't take a joke.
Yeah.
Yeah, that's something that racists say. They say, I was only joking. Sexism, I was only joking. They can't take a joke. So though you say it's funny to look for a fallopian tube, the shame that goes with being found out.
There's a point at which I think some of these things.
I think you have to be careful
yeah,
about humour.
I agree. No, I
know
agree.
you agree.
I agree.
Yeah.
I agree.
It can be funny, but the shame of being realised that you've made the mistake that you had to go looking for a fallopian tube, then you feel stupid. Then you're already undermined. And it just starts, just there, that little bit of weakness, and then it starts. And I call it, we've talked about this, I call it an abuse of power. So if you're senior to me, you have power over me to make my job better or to make my job worse. And you can use your power benignly. Hey, you don't make a bed like that. Or, yes, she's incontinent, but actually this is an easy way of managing it. Or you can say, well, go and learn for yourself. And that's an abuse of power. And I think as the harassment goes on and the bullying goes on, the person who is abusing their power are doing it malevolently. Whether they're doing it consciously or not, I don't know. Yeah, so...
sometimes they consciously do it, and sometimes it's an unconscious...
It's completely...
Yeah.
I mean, it's interesting, we're now onto the unconscious. we're going to seize on that. We're here at the recording at the Tavistock Clinic. But I think psychodynamic ideas are very helpful in trying to understand bullying, because bullying is such a complicated, dynamic relationship, because it'd be nice if we could divide the world into bullies and victims, and we just get rid of the bullies and everything's done. But of course, it's much more dynamic and fluid than that. That if, for example, you're working in a bullying culture, you're part of bullying, whether you choose to be or not. A lot of bullying is done by gangs, groups, not just one individual. So I'm going to ask Angela the question about how psychodynamic ideas can help us understand what's going on when bullying is taking place. So we've got this idea of an abuse of power, but there's also about splitting and projection and gang-like states of mind which allow bullying to take place.
Well, I'd like to talk about the gangs, because I'm absolutely sure that working in a clique or a gang inside a hospital or wherever has got to do with finding being acceptable to the dominant culture. So if there is a clique in there who have the power, you have to choose as a new person or somebody that's seen it, am I going to be part of that clique that's got the power, the gang, or am I not? And I know people who have watched bullying and have felt too ashamed and scared about their own job to whistleblow. Because they will then be on the outside. So the wish to be part of something and to be acceptable to the dominant culture, we know is a huge pull. Okay, so when people say gang culture, I would ask them to think about their own need for, our own need for acceptability. Want to be part of something, a tribe or a group or a profession. And the shame of watching something and not doing something is so either you're letting down your gang, or you're letting down yourself, or you're letting down your colleague. And either way you're lost. Either way you're lost. You asked me to talk a little bit about splitting and projection. Elsie and I talked a little bit earlier about the bully, and I said gently how damaged the bully is. Even though as victim, you don't feel that they're damaged, they feel all powerful. And my understanding is that the bully is grown from having been in a position of abusive power themselves. So a lot is known about child sexual abuse and a lot of data about the early experience of predators. So I would argue that the bully themselves had an early modelling of what power was about by being bullied. And rather than owning up to it and working on it, because it would be a huge piece of work on their own unconscious and their own experience, they then find pleasure or recognition in being able to bully. It reinforces something about their own experience. So the other thing we talked about is being a victim in some way speaks to us as if we deserved it. Now, we don't. Like, women don't deserve to be raped, and we don't deserve to be bullied. But inside of us, there is a bit of us that could also bully. And so meeting somebody that is bullying us somehow reinforces a hierarchy of power, which we know is right. Now, it's not right, but that's what we may have been brought up to believe. But certainly when I was bullied, I thought I deserved it. I thought I was wrong. I thought I was inexcusable in my behaviour. It spoke to me of something that I must have known about.
And I think this is very important, isn't it? It's difficult to talk about when you're being bullied, for somebody to say there's something internal happening here. But there's something that we have to understand about the power of a bully. Because from the outside, your friends will say, but they're not right. You're a great person. But that's not how it feels. And in the training that I work on around bullying, we do this by trying to think about the internal bully.
Okay.
And I find it very helpful to think about it as a projection of vulnerability, that the bully, it's like when you see a violent person, you have to remember that often that person is afraid, actually, and they're trying to make you feel what they're feeling. So the bully projects their vulnerability, their weak sense of themselves, into you.
The unowned sense of vulnerability, that's the point.
That's
the
right.
Splitting.
That's the splitting. I'm very powerful, I'm the bully, you are weak, you are vulnerable. And that it latches into an internal voice that we all have, whether we like it or not, which says, oh yeah, they might have a point. And it depends how powerful that internal voice is. And a lot of us that work in vocational professions have super egos the size of tanks. You know, we've got this very strong moral sort of categorical voice which says you must do this and you must be absolutely right and you must be always real demands on the system. And over time that can really wear us down and make us very vulnerable to the external voices that say, you know, be ashamed, you're vulnerable, I'm stronger than you. So I find psychodynamic ideas very helpful because they're dynamic. They explain something that's happening externally as well as what that feels like. Because that's the hard thing, isn't it, with bullying, is this feels awful.
Yeah.
And the power of that awfulness is almost inexplicable, isn't it?
And just to go back to what you said about the gang culture and that, I couldn't understand why other people were looking on and not doing anything because it was very visible what was happening. And nobody, except for this one person who actually saved me, really, nobody said anything. It was as they were complicit in what was going on.
Complicit, but they're also immobilised by the whole system. They shouldn't be. We shouldn't be.
It was astonishing.
Well, we know about atrocities in war zones where people just stood and watched.
Yeah.
You know, we see people in the street. I hear women screaming in the street and I'm unsure about whether I should go and help them or not. You know, we see it around us. And we'll get onto it at the end, you know, what resilience we need to be able to whistleblow as you did. Yes. It's a huge thing to have to do.
And I think
I'm not excusing this by
Oh
standards,
no,
by the
no,
way.
no. I just think it was, you know, it's a part of what allows it to
makes
go
it worse
on.
because it makes you think. It made me think.
That's right.
I'm in the wrong.
That's
They're
right.
all right. Look, most of the people aren't saying anything. So why am I making such a big fuss? Why is it hurting me so much? What's going on for me? That, you know, what have I done? As you said, I did nothing to this woman.
Absolutely nothing.
But for her, you will have done something which you won't understand.
Well, it's really interesting because I actually had a chance to. We had a chance to speak about it after.
And can you talk about it?
Yes, I can. And she said we were in fact going somewhere. I needed to I can't drive well on the motorway, so I needed a companion. And I asked her, are you doing anything? Could you please, we'd resolve this issue ourselves. Can you come with me? So we went on this long drive. It was about 3 hours there and 3 hours back. So we had time to talk. It was just us.
Oh.
And the thing, I was in automatic really when she said it. She said, and you know that thing, Elsie, between us? And I said, yes. And she said, I don't know what that was about.
Right.
I was so shocked. Really, I was shocked. How can you understand or not understand what you're doing to someone? And it was quite something.
Wow. You were driving.
I was driving. I was on the motorway, so it wasn't as though I had to negotiate a corner. Yeah.
How did you respond to her?
I said nothing. And there was nothing to say. Really.
You see, that's nearly an abuse again. To catch you in a vulnerable moment, to raise all of that stuff, and then, though she was confessing.
But by that time we had resolved.
Yes,
but and this is the thing, relationships are so complex. But by that time I had represented her as a trade union rep. So my resilience had returned to its norm. So I wasn't in any way threatened. I was just shocked by this lack of understanding on her part, because she is a practicing midwife. She understands the dynamics, I thought, between her work and what she was doing, the outcomes and so on. So I just kept driving. Kept driving. But I think it's people's behaviour and abuse of each other really needs, and clearly I don't understand all of it either myself.
Yes, you do.
But it really needs looking into, and it has been the subject of at least 2 PhD dissertations that I know of in midwifery. So clearly, there is a lot of, and it's still going on.
I'm very moved by what you've just said, and it's sort of, I'm always moved to hear people's stories of working in health and social care, because this, whatever your status in this hierarchy and food chain is, you have to have this capacity to bear these profound facts of life. Yeah. You can't avoid them, and just to bear it. This is how it is, because so much in life, particularly in working life, is so sanitized, isn't it, from the reality of being a human being. It's really complicated. There are no heroes or villains. We're all, in this mix and put in the wrong place at the wrong time. We're all vulnerable to these kinds of attacks. And when you've gone through these experiences, you have to bear it. You have to bear that knowledge at a time when other people, lucky them, haven't had to face up to that reality.
Or they have been able to deny it and move on, or work around it, or, they just not had to. So the level of survival denial is huge. Yes, that's awful, but actually I can manage around it.
So would there be a whole person? You see, for me, need to resolve these things. Need to be resolved and
far be it from me to be judgmental.
You're amongst friends here.
That's how I feel. I feel like I wouldn't be a whole person.
But of course, maybe a lot of people don't understand the experience of wholeness. It's taken me years of psychotherapy to even begin to understand what a whole person might look like.
Well,
it's not. It
I
doesn't.
would be uncomfortable, So now we meet this young person. Well, she's younger than I am. We meet at various different things, and it's a hello and a hug, and do you know what I mean? We've resolved it and put it. Well, I've resolved it and put it down.
You've done the work. We're going to come on to a question about how you survived this.
Right,
You've done the work.
Okay.
You said 3 or 4 times, just in the short space of time, after years of thinking about this and understanding and reading and PhDs, and I'm beginning to understand it. You're doing the work, and it's hard. It's hard to do the work. It's hard to be always conscious and thoughtful and integrity and ethical and all that. It's hard. Not everybody can do it.
But my feeling is certainly in terms of being a midwife, and it is a very difficult profession, not necessarily, but a different scenario in which to be working, because you're working to, I hate the word empower, but you're working to empower women, or certainly to support them along a life journey, which is emotional and physical, and it's everything. And what you're actually doing is supporting that person to birth the world, really. That's what we're doing. Yeah. And if we don't do it from a perspective of understanding what it is we're doing, what are we doing?
Well, people do it to the best of their capacity.
Okay.
I think what you're showing me is your capacity and your resilience and your values are so integrated that you can only do it as a whole person. That's you. I think you're unusual.
Okay. But actually, I'm just listening to you say that, and I'm thinking, actually, it makes me quite vulnerable, really. Yeah.
But it also makes you more resilient as well, to know that about yourself.
Yeah, I know where my boundaries are, do you know?
Yeah.
So this is going to bring me on to my two final questions.
Final questions. We've just got into it.
By the way, Elsie is not crying. We
No.
have a vicious air conditioning in this room. My first question is, give me some sense of how you can protect yourself as an individual when it comes to bullying.
Okay. I think you have to be able to recognize it, and that I recognize to have been my first step. To recognize that something is seriously wrong and it's actually going to damage me if I don't do something about it. Ask me the question again.
What can you do as an individual
Okay.
to deal with bullying?
I also think you need somebody on your side, somebody to support you, somebody to just guard your space when you need that to happen, to be an ear for you, and to not stand up for you necessarily, but to point you in the direction of how it is that you, and these are the things that help me. Find things to help me to help myself, really. And I think, to be honest, although I didn't admit it at first, I was told twice to leave the organization. Twice. Leave before they push you out. Sometimes you have to leave, and I now recognize that. And you do need a supportive group of people around you. You need to also be able to contain the situation so that it doesn't affect the rest of your life, because it actually can destroy your family life, your professional, everything that is you. It can destroy you. So you have to find some way of dealing with the situation, putting it down and getting on with the rest bits of your life.
I think what you're saying is catch it early. Because I think what you've experienced and what I've worked with is this when it's gone too far. So if one had the awareness of what was ethical behaviour and reasonable requests and demands from management and reasonable sets of behaviour, if you could catch it early enough before it became damaging. So that's the point. So I would say absolutely everything you said, and with the awareness, an immediate touchstone, reflective group, reflective individual, before you go mad. Because once you've gone past the point of being bullied that you're in pieces, you can't hear it. So immediately being able to take it to an ally or somebody to say, this is going on, what does it sound like? And for them to say, this is not on. You are absolutely right, this is not professional behaviour or standards or anything we will have in this organisation. so that the moment it happens, you're not isolated.
Yes.
You immediately get some sort of ally or touchstone or reflective practice.
So I'm just going to expand on that
Yeah.
and go ask you the question: what as organisations can we do?
Right. So do you want Elsie, or shall I tell you about the?
Tell me a bit.
I'm very privileged to work with a higher education college, who very scientific and health based, and of course there's a lot of bullying around research projects and all of that sort of stuff. They set up a harassment support group in which individuals from right the way across the organisation, from any department, any rank, any status, any educational background, came together, and I helped them think about the role of being a harassment support person, not to be their advocate, not to go to court with them, but to help them be that reflective person, and not to train them as therapists, not to train them as counsellors, but to train them to be a support person. And anybody that felt that they were being harassed inside the organisation, go to any of them, and we publicised them and we showed their faces, different cultural backgrounds, so that people could go to a man or a woman or somebody from their own language base, whatever. And they did a fantastic job, and they became a cohort themselves about, sharing that piece of information. But that was a huge institutional intervention based on one person's commitment and leadership, and they fought their way through all the HR policies, through all the academic hierarchies, and they got it. But it was a 5-year project, and I'm very proud of them.
So they must have been well resourced to do that.
No,
That's
because
interesting.
each of the harassment support people, they were allowed time off. We finally got it through the HR policies that if you came to me, I could take a couple of hours off work if my boss wasn't too much of a bully. They were recognised as being, stars. So it was resourced emotionally by the organisation.
Gosh, excellent.
Interesting. And that must chime with the work that you've been doing subsequently with midwives.
Yes, out of my experience and the experience of having other midwives in the same workplace come to me, I got some funding to set up a social enterprise called Midwifery Conversations. And we are largely online, but we do come together to have reflective discussions about anything midwifery. So it could be clinical stuff, but it's a lot to do with the culture and the climate of the profession and the ways in which we have to work, but also alternative ways of working that minimize these bullying behaviours.
And building up one's own resilience.
Through that,
to face it,
through that, you develop ways and means, and we have a Bible there is a bullying Bible that we use. So,
I wish I had known when I was being bullied that I should have stood up and said, "You can't do that to me. Don't mess with me. I'm a person." But I didn't know.
But I think the benefit of certainly our experience is that we can do that for other people now.
Yes.
Ladies, on that note, thank you very, very much for this conversation about bullying. I haven't enjoyed a conversation about bullying so much in my entire career.